So other issue is, of course, mask. That again a debatable issue. There is no study that shows that mask. Adults may they have done studies to randomized trial in Bangladesh, in Denmark. They found no impact of mask. Surgical mask reduces 11% in Bangladesh. Cloth mask does not reduce. And surgical mask has to be used properly. Once you touch a mask, you have to discard it. But the same mask is used throughout the day, sometimes 2 days, 3 days, put it in the pocket, take it back again, put it. So that is not the way. It may be spreading more infection, particularly in children. If you see, children can't take care of the mask. So this requires, again, scientific studies to be on the precautionary principle. Everybody was masked, but Omicron does not the transmission of Omicron is not checked by mask. It is so transmissible. And are we giving rise to other infections? We don't know. Then most important in children are the development of language, development of emotions. So if they are masked, they may be again causing, and they are not preventing COVID also. Because COVID transmission has occurred all over the world in spite of mask and all that. So we have to again take a call. More studies are required.